Waking up with puffy eyes? Your kidneys might be leaking protein. 37 million Americans have kidney disease, and 90% do not know it. I will show you 7 warning signs your kidneys are failing, and 7 science-backed foods that may help reverse damage. Real studies on real patients. Your kidneys filter your blood every single day. They remove waste and keep you alive. But here is the problem. Most people do not realize their kidneys are failing until it is too late. Right now, 90% of people with chronic kidney disease have no idea they have it. No pain. No obvious symptoms. Their kidneys are slowly dying and they feel fine. That is what makes kidney disease so dangerous. By the time you feel sick, your kidneys may already be severely damaged. You might need dialysis. You might need a transplant. The early warning signs are easy to dismiss. You might think your fatigue is just stress. Your puffy face is just allergies. Your cold hands are just poor circulation. Most people ignore these symptoms because they seem normal. But your body is trying to tell you something important. Today, I am going to show you 7 warning signs that are often ignored. These are real symptoms that kidney patients experience before diagnosis. And then I will share 7 foods backed by actual scientific studies. Foods that may help protect your kidneys and slow down damage. This is not about expensive supplements or complicated diets. This is about simple changes you can start today. So, let us get into the first warning sign. Sign number 1. Puffy eyes in the morning. Wake up and look in the mirror. Your eyes are swollen. Your eyelids are puffy. You look tired even after 8 hours of sleep. Most people blame this on allergies, or too much salt at dinner, or just getting older. But if this happens every single morning, your kidneys might be leaking protein into your urine. Here is what is happening inside your body. Healthy kidneys keep protein in your blood where it belongs. Protein is important because it holds fluid inside your blood vessels. But when your kidney filters get damaged, protein starts leaking out through your urine. This is called albuminuria. When you lose protein from your blood, fluid can shift into other parts of your body. And because you sleep lying down for hours, that fluid collects around your eyes. This is why your face looks puffy when you wake up. The swelling usually goes down during the day when you are standing and moving around. This is often one of the earliest signs of kidney damage. It can happen years before you feel sick. Many people ignore it because the puffiness is mild. They think it is normal, but your kidneys are already struggling to do their job. If you notice puffy eyes every morning for more than 2 weeks, talk to your doctor. A simple urine test can check for protein. Early detection matters because kidney damage may be reversible in the early stages. The longer you wait, the harder it becomes to protect your kidney function. Pay attention to what your face is telling you each morning. Sign number 2. High blood pressure that will not go down. You take your blood pressure medication every day. Maybe you take 2 pills, maybe 3, but your blood pressure stays high. 150/90, 160/95. Your numbers refuse to drop no matter what you do. This is frustrating. You follow all the rules. You cut back on salt. You exercise. You take every pill your doctor prescribes, but nothing works. Here is what most people do not know. Your kidneys control your blood pressure. They do this by managing how much fluid stays in your body and by releasing hormones that tighten or relax your blood vessels. When your kidneys start failing, they lose control of this system. Damaged kidneys cannot remove extra fluid from your blood. This extra fluid increases the pressure in your blood vessels. Your kidneys also start producing too much of a hormone called renin. This hormone tells your blood vessels to squeeze tight. Tight blood vessels mean higher pressure. So you end up in a dangerous cycle. High blood pressure damages your kidneys. Damaged kidneys cause even higher blood pressure. The medications help, but they cannot fix the root problem if your kidneys are failing. If you are taking 2 or more blood pressure medications and your numbers still will not come down, your kidneys might be the real issue. This is called resistant hypertension. It affects about 1 in 10 people with high blood pressure. Ask your doctor to check your kidney function with a simple blood test. They will measure something called estimated glomerular filtration rate. This tells you how well your kidneys are filtering waste. Catching kidney problems early may help you get your blood pressure under control. Sign number 3. Ammonia or fish breath. You brush your teeth twice a day. You use mouthwash. You chew gum, but you still taste metal in your mouth, or your breath smells strange. Some people say it smells like ammonia. Others say it smells like fish. No matter what you do, the taste and smell will not go away. This is not a dental problem. This is waste building up in your blood. Your kidneys are supposed to filter out toxins and waste products. One of these waste products is called urea. When your kidneys are healthy, urea gets removed through your urine. But when your kidneys start failing, urea stays in your blood. This condition is called uremia. When urea levels get too high, your body tries to get rid of it any way it can. Some of that urea comes out through your saliva. Your mouth breaks it down into ammonia. That is why you taste metal. That is why your breath smells bad. You can brush your teeth 10 times a day and it will not help because the problem is not in your mouth. The problem is in your blood. Many people also notice that food tastes different. Everything tastes bland or metallic. You might lose interest in eating meat because it tastes wrong. This happens because uremia affects your taste buds and changes how you experience flavor. If you have persistent bad breath that does not respond to oral hygiene, get your kidney function checked. This symptom usually shows up when kidney damage is already significant. A blood test can measure your blood urea nitrogen levels. High levels mean your kidneys need attention right now. Sign number 4. Feeling cold all the time. It is 80 degrees outside. Everyone else is hot. But you are freezing. You wear a sweater while others wear shorts. Your hands feel like ice. Your feet are numb. You cannot get warm no matter how many blankets you pile on. People tell you it is just poor circulation, or maybe your thyroid. But the real cause might be your kidneys. Healthy kidneys make a hormone called erythropoietin. This hormone tells your bone marrow to produce red blood cells. Red blood cells carry oxygen throughout your body. They also help regulate your body temperature. When you have enough red blood cells, your body stays warm. But failing kidneys stop making enough erythropoietin. Without this hormone, your bone marrow slows down. You produce fewer red blood cells. This condition is called anemia. And anemia makes you feel cold all the time. Your body is not getting enough oxygen. Your cells cannot produce enough heat. Your blood cannot carry warmth to your fingers and toes. So you feel freezing even when the temperature is perfectly normal. Other people are comfortable, but you need extra layers. Anemia from kidney disease also makes you feel exhausted. You get tired walking upstairs. You need to rest after simple tasks. The cold feeling and the tiredness often happen together because they have the same root cause. Not enough red blood cells. Sign number 5. Dark cola-colored urine. You go to the bathroom and notice your urine is dark brown, not light yellow, not clear, dark brown or reddish brown. It looks thick. It might even look cloudy. This is blood in your urine. Doctors call this hematuria, and it is a serious warning sign that your kidneys are damaged. Healthy kidneys keep blood cells inside your blood vessels where they belong. The kidney filters are designed to let small waste particles through while keeping larger things out. Blood cells are too big to pass through healthy kidney filters. But when your kidney filters get damaged, they develop tiny holes. Blood cells can squeeze through these holes and end up in your urine. Sometimes you can see the blood with your eyes. The urine looks dark or brown. Sometimes the blood is invisible and only shows up on a urine test. Dark urine can also mean your kidneys are not filtering properly and waste products are building up. Either way, brown or dark urine is not normal. Clear or pale yellow is normal. Anything darker needs attention. Some people ignore this symptom because it does not hurt. Your kidneys do not have pain nerves, so kidney damage rarely causes pain until it is very advanced. You can have serious kidney problems and feel absolutely nothing. The only clue is what you see in the toilet. If your urine is consistently dark for more than 2 days, see a doctor immediately. They will do a urine test to check for blood and protein. They will also do blood tests to check your kidney function. Dark urine is your kidneys calling for help. Do not wait. Sign number 6. Persistent hiccups. You get hiccups. They start after lunch, but they do not stop. Hours pass. The hiccups keep going. You try holding your breath. You drink water. You try every trick you know. Nothing works. The hiccups continue for hours, sometimes for days. This is not normal. Regular hiccups last a few minutes, maybe an hour at most. But when hiccups persist for hours or days, something serious might be wrong with your kidneys. Here is what causes this. Your diaphragm is the muscle under your lungs that helps you breathe. It is controlled by a nerve called the phrenic nerve. When waste products build up in your blood from kidney failure, these toxins irritate your phrenic nerve. The nerve sends mixed signals to your diaphragm. Your diaphragm starts contracting in short bursts. That is a hiccup. Uremia is the medical term for waste buildup in your blood. When your kidneys cannot filter properly, urea and other toxins stay in your bloodstream. These toxins affect your nerves and muscles throughout your body. The diaphragm is especially sensitive to these chemical changes. Many dialysis patients report having persistent hiccups before they were diagnosed. It is one of those strange symptoms that people do not connect to kidneys. You might think it is acid reflux or stress. But if your hiccups last more than 48 hours, your kidneys might be the real problem. Pay attention to how long your hiccups last. A few minutes is normal. A few hours is concerning. A few days means you need to see a doctor immediately. Get blood tests to check your kidney function and urea levels. Sign number 7. Restless legs at night. You get into bed, you are tired, you want to sleep, but your legs will not stay still. They feel uncomfortable, itchy from the inside. You need to move them. You stretch, you kick, you shift positions. But the feeling comes right back. Your legs will not let you rest. This is not just being fidgety. This is a real medical condition called restless leg syndrome, and it affects 20 to 40% of people on dialysis. Many people experience this symptom before they even know their kidneys are failing. Your nerves need certain minerals to work properly. Calcium, magnesium, phosphorus, and iron must stay balanced. Healthy kidneys keep these minerals at the right levels, but failing kidneys lose control of mineral balance. Phosphorus builds up. Calcium drops. Iron gets too low. When these minerals go out of balance, your nerves start misfiring. They send strange signals to your leg muscles. Your brain gets confused messages that something is wrong with your legs. You feel an overwhelming urge to move them. The sensation is hard to describe. It is not pain exactly. It is an uncomfortable crawling or pulling feeling deep in your muscles. This symptom gets worse at night when you lie still. It interrupts your sleep. You wake up exhausted because your legs kept you moving all night. Many people think this is just stress or anxiety. But if you have restless legs combined with any other symptoms on this list, your kidneys need to be checked. A blood test can show if your mineral levels are off. Treatment can help, but first you need to know if kidney disease is causing the problem. Those 7 warning signs are serious. If you have even one of them, your kidneys need attention. But here is the good news. Your kidneys can heal, especially in the early stages of kidney disease. The right foods may help slow down damage. They may reduce inflammation. They may support your kidney function. And you do not need expensive supplements or complicated meal plans. I'm going to share 7 foods backed by real scientific studies. Studies on real patients. These foods are simple. You can find them at any grocery store. Let me show you what they are. Food number 1. Buckwheat. Most grains are dangerous for kidney patients. Rice has too much potassium. Whole wheat bread has too much phosphorus. Pasta can spike your blood sugar. So what can you eat? Buckwheat. This grain is different. It has low potassium levels. It has low phosphorus levels, and it will not harm your kidneys. Renal dietitians recommend buckwheat as a safe alternative for people with chronic kidney disease. Buckwheat is also gluten-free. If you have celiac disease or gluten sensitivity on top of kidney problems, this grain works for you. It contains B vitamins that help your energy levels. It has magnesium for your muscles. It has iron to fight anemia. all without overloading your kidneys with minerals they cannot handle. You can use buckwheat in many ways. Buy buckwheat groats and cook them instead of rice. They have a nutty flavor and a soft texture. You can also find buckwheat flour to make pancakes or bread. Some stores sell buckwheat noodles called soba noodles. Just check the ingredients because some soba noodles mix buckwheat with regular wheat. 1 cup of cooked buckwheat has about 135 milligrams of potassium. Compare that to brown rice, which has 154 milligrams. The difference might seem small, but every milligram matters when your kidneys are struggling. Multiple kidney disease diet guidelines list buckwheat as a recommended grain. The National Kidney Foundation includes it in their kidney-friendly food lists. This is not some new, trendy superfood. This is a scientifically supported choice for protecting your kidney function. Start with small portions. See how your body responds. Then make buckwheat a regular part of your meals. Food number 2. Arugula. Finding leafy greens you can safely eat with kidney disease is hard. Spinach has too much potassium. Kale has too much potassium. Swiss chard will spike your levels. So what green can you actually eat? Arugula. This peppery green is one of the few leafy vegetables that is safe for chronic kidney disease. It has low potassium levels, much lower than other greens. Renal diet guidelines specifically recommend arugula for people who need to watch their potassium intake. Arugula gives you vitamin K for bone health. Your bones need vitamin K to stay strong. Many kidney patients develop weak bones because their kidneys cannot process calcium and phosphorus properly. Arugula helps protect your bones while being gentle on your kidneys. It also contains manganese and calcium. These minerals support your overall health without overloading your system. The peppery flavor means you can use less salt in your food. Salt is dangerous for kidney patients because it raises blood pressure and makes your kidneys work harder. You can eat arugula raw in salads. Wash it well and toss it with a little extra virgin olive oil and lemon juice. You can also cook it lightly. Add it to pasta at the end of cooking. Mix it into scrambled eggs. Put it on sandwiches instead of lettuce. Buy fresh arugula and use it within a few days. The leaves wilt quickly. You can also find baby arugula, which has a milder flavor. Some people find regular arugula too spicy. Baby arugula is gentler, but gives you the same kidney-friendly benefits. Food. Number 3. Shiitake mushrooms. You need to cut salt from your diet. But food tastes bland without it. Everything is boring, you lose your appetite. This is a huge problem for kidney patients because you still need to eat enough protein and nutrients. Shiitake mushrooms solve this problem. These mushrooms have a rich, meaty flavor called umami. Umami is the 5th taste that your tongue recognizes. It gives food a deep, satisfying taste without any salt. When you cook with shiitake mushrooms, your meals taste full and delicious, even with 0 added sodium. Shiitake mushrooms are also low in potassium. 1 cup of cooked shiitake has only about 45 milligrams of potassium. That is remarkably low for a vegetable. They also contain compounds called beta-glucans that support your immune system. Kidney disease weakens your immune system, so this extra support matters. Plant-based diet research for chronic kidney disease specifically mentions mushrooms as beneficial. They give you nutrients without overloading your kidneys with minerals. You get protein, B vitamins, and selenium. All important for kidney patients. Here is how to use them. You can buy fresh shiitake mushrooms or dried ones. Dried shiitake actually have more concentrated flavor. Soak dried mushrooms in warm water for 20 minutes. Then slice them and add them to soups, stir-fries, or pasta dishes. Save the soaking water and use it as a flavorful broth. Fresh shiitake work great too. Remove the tough stems and slice the caps. Sauté them with garlic and a little olive oil. The aroma is incredible. The taste is rich and satisfying. Add shiitake mushrooms to your meals 3 to 4 times per week. Your taste buds will be happy. Your kidneys will be protected. Food. Number 4. Macadamia nuts. Kidney patients are told to avoid nuts. Almonds have too much phosphorus. Peanuts have too much potassium. Walnuts will overload your system. But you miss having nuts as a snack. You miss that crunch and satisfaction. There is one nut you can safely eat: macadamia nuts. These are the only nuts low enough in both potassium and phosphorus for people with chronic kidney disease. 1 ounce of macadamia nuts has only 104 milligrams of potassium. Compare that to almonds, which have 208 milligrams. That is half the potassium load on your kidneys. Macadamia nuts also have lower phosphorus than other nuts. This matters because failing kidneys cannot remove excess phosphorus from your blood. High phosphorus weakens your bones and damages your blood vessels. Macadamia nuts give you the nutrition and satisfaction of eating nuts without that danger. They contain healthy, monounsaturated fats, the same fats found in olive oil and avocados. These fats may help reduce inflammation in your body. They also contain folate, which is a B vitamin that supports your overall health. Kidney-friendly diet lists from major medical centers specifically recommend macadamia nuts over all other nuts. This is not just one random study. This is consistent guidance from renal dietitians across the country. Eat them in moderation. 1 ounce per day is a good limit. That is about 10 to 12 nuts. You can eat them plain as a snack. You can chop them and sprinkle them on salads. You can crush them and use them as a coating for fish or chicken. Buy raw or dry roasted macadamia nuts. Avoid the ones covered in salt or sugar.
Plain is best for your kidneys. Food number 5, extra virgin olive oil. What if 2 tablespoons of oil could improve your kidney function? Sounds too simple to be true.
But researchers tested this on 40 actual kidney patients, and the results were impressive. Extra virgin olive oil, not regular olive oil, not vegetable oil. Extra virgin matters because it contains special compounds called polyphenols. These polyphenols have names like hydroxytyrosol and oleocanthal. You do not need to remember those names. Just know they fight inflammation and oxidative stress. The study ran for 9 weeks. Patients consumed 40 milliliters of extra virgin olive oil every day. That is about 2.5 tablespoons. After 9 weeks, their kidney function improved. Their estimated glomerular filtration rate went up. Their albumin in urine went down. Their uric acid levels dropped. Their inflammation markers decreased significantly. The researchers published this in peer-reviewed medical journals. Multiple studies from Italy confirmed these findings. This is not internet hype. This is real science on real patients with chronic kidney disease. Here is how to use it. Do not cook with it at high heat. High heat destroys those beneficial polyphenols. Instead, drizzle it raw over your food. Pour it on salads. Mix it into cooked vegetables after they cool down a bit. Use it as a dip for bread. Add it to soups right before eating. Buy extra virgin olive oil in dark bottles. Light damages the polyphenols. Store it in a cool, dark place. Use it within 6 months of opening. 40 milliliters daily, that is your goal. Some people take it straight from a spoon each morning. Others spread it throughout the day over meals. Find what works for you and stick with it. Food number 6, cranberries. Urinary tract infections are common with kidney disease. The infection causes pain. It can make your kidney problems worse. Doctors usually prescribe antibiotics, but taking antibiotics over and over creates resistant bacteria. You need another option. Cranberries work. Researchers analyzed 50 studies with 8,857 participants. This was a massive Cochrane review published in 2023. The results were clear. Cranberries reduce urinary tract infections in women with recurrent infections and in children. Cranberries contain compounds called proanthocyanidins. These compounds prevent bacteria from sticking to the walls of your bladder. The bacteria cannot attach, so they get flushed out when you urinate. No attachment means no infection. The studies also show cranberries have anti-inflammatory effects. Inflammation damages your kidneys over time. Anything that reduces inflammation may help protect your kidney function. Cranberries also contain antioxidants that fight oxidative stress. Oxidative stress is another factor that harms kidney tissue. You can eat cranberries in different forms. Cranberry juice works, but choose unsweetened juice. The sweetened versions have too much sugar, which is bad for your kidneys and blood sugar. 1/2 cup of cranberry juice has only 22 milligrams of potassium. That is very low. You can also eat whole cranberries. Fresh or frozen cranberries work well in smoothies. Dried cranberries make a good snack, but watch the added sugar. Some brands coat dried cranberries in sugar syrup. Cranberry supplements exist, but juice and whole berries give you better results according to the research. Aim for 1/2 cup of unsweetened cranberry juice daily, or eat a handful of fresh cranberries several times per week. Protect your bladder. Protect your kidneys. Add cranberries to your routine. Food. Number 7. Ginger. Your creatinine levels keep going up. This waste product builds in your blood because your kidneys cannot filter it out anymore. High creatinine means your kidney function is dropping. You feel helpless watching those numbers climb. Ginger may help lower those levels. Scientists studied ginger and kidney disease in 41 different research projects. The results were consistent. Ginger helped reduce blood sugar levels. It helped lower creatinine. It reduced inflammation and oxidative stress in kidney tissue. Ginger works by reducing inflammation in your kidney tissue. It contains compounds called gingerols and sugars. These compounds act as powerful antioxidants. They fight the free radicals that damage your kidney cells. They also help your kidneys process glucose better, which is critical if you have diabetes and kidney disease together. Multiple meta-analyses confirm ginger has nephroprotective properties. That means it protects your kidneys from further damage. It may help slow down the progression of chronic kidney disease, especially in people with diabetes. Ginger is also very low in potassium. You do not need to worry about it spiking your levels. It is safe for kidney patients when used in normal food amounts. You can use fresh ginger or ginger tea. For fresh ginger, peel a 1-inch piece and grate it into hot water. Let it steep for 10 minutes. Drink this once or twice daily. You can also add fresh grated ginger to stir-fries, soups or smoothies. Ginger tea bags work too. Steep 1 bag in hot water for 5 to 10 minutes. Do not add sugar. You can add a little lemon juice for flavor. Start with small amounts. See how your body responds. Then make ginger part of your daily routine. You just learned 7 warning signs your kidneys might be failing, and 7 foods that may help protect your kidney function. This information gives you power. You can take action today. Your kidneys can heal, especially if you catch problems early. These simple foods are available at any grocery store. You do not need expensive supplements or complicated meal plans. If this video helped you, please subscribe to this channel. Hit that notification bell so you never miss important health information. Leave a comment below. Tell me which warning sign surprised you the most, or which food you will try first. I read every single comment. Remember, your health is in your hands. Small changes today can protect your kidneys for years to come. Take care of yourself. You deserve it. Disclaimer. This information is educational only. Do not stop your kidney medications. Your potassium and phosphorus needs are individual. Always check with your kidney doctor before changing your diet. Get regular lab tests.